Really, we got sad news today, Megan, that in fact Canada has suffered its first death from coronavirus at a long-term care home in Vancouver. What more do we know about that first death?
Yeah, that's right, Jennifer. A lot of developments happening today in terms of COVID-19 in Canada, and perhaps the most significant is now the country does have its first COVID-19 related death. This is linked back to a long-term care facility in North Vancouver. This was identified as a hotspot for coronavirus around 3 days ago, as there are a number of cases now being linked to this facility, and it is essentially in lockdown at this point. So we know that this is a man in his 80s. He was a resident of this care center. There were also additional cases announced today, 5 new cases in BC, 3 of them being linked to that facility, 2 of them being residents and 1 of them being a worker there. We also know that of the new cases announced in BC today, two of them are travel related. A woman in her 50s had recently traveled from Iran. A man in his 30s had recently traveled from Italy. He and the other travel-related case, as well as the worker, are also all in home isolation at this point. They do not require hospitalization. But of course, this latest development of there being a death now in Canada, in BC in particular, concerning for officials here. And here's what our province's Chief Medical Health Officer had to say about how they are tracking the transmission of this virus in our province. Take a listen.
Our focus is on breaking what we call those chains of transmission. So trying to identify anybody, and this there's a number of case in point. The case from Iran is one. The fact that we had somebody, we've been doing surveillance in our community level. So all of the influenza tests in the lab are automatically tested for COVID-19. That's how we identified the healthcare worker and now the outbreak at the Lynn Valley Care Center. So our focus is on making sure that we can find people really quickly.
Of course, a concern here in BC also is the growing number of cases just south of the border in Washington state. A lot of people here frequent the United States for simple things as much as groceries, going to south of the border for gasoline as well. And so officials here are concerned about the number of cases that are cropping up there. 51 are now being announced in King County. That is a hotspot in Washington state, in the Seattle area. And so at this point, officials on this side are not looking at any travel restrictions, as Dr. Bonnie Henry said that would be nearly impossible to control that. But there is that constant communication happening with her counterparts in the U.S. Jennifer.
There's so many questions people have today. She was also asked about the busy cruise ship season coming up, you know, in the months ahead, especially on the West Coast. And no firm decisions right now, but as we do know today, Canadian officials saying they do not recommend traveling on cruises right now. You've been tracking the numbers across the country now. Where do we stand?
Yeah, that's right. So with these new cases that were just announced in Alberta and BC, we got more information on that, but that brings our total in Canada now. We have 77 cases of coronavirus across the country, and we also have a breakdown of that by province. Ontario has the most cases with 34. BC now has 32. In Alberta, there are 7, and in Quebec, there are 4. So we're learning more about the new cases announced. Let's start with Ontario. That province now up to 34 cases. All of these are still travel related. We do not have any community transmitted cases of this anywhere else in the country except for in BC. So in today's new cases, 1 man in his 50s had recently traveled to Germany. We have other cases of a man in his 80s, a woman in her 70s. They had recently traveled to Iran, and all 3 of those are at home in self-isolation. We know that it is not circulating locally in Ontario just yet, as I mentioned, but officials are concerned about that being a development in Ontario, but they are actively testing. They say that 2,400 people have been tested for coronavirus in Ontario, so we know that the majority of those are coming back negative. Now to the latest out of Alberta, 3 new cases just announced there. We know that one of them is a woman in her 70s who had been linked to a previous case, a man in his 30s who had recently traveled to Ukraine, the Netherlands, and Turkey. He is in the Calgary region, and a woman in her 50s who is linked to a Caribbean cruise. She had also returned in March. All 3 of those are also in self-isolation. Also in Alberta, still no community transmitted cases there at this point either. But officials are stressing the fact that while the risk is still considered to be low in Canada to contract coronavirus, the risk worldwide is growing, and people should really start thinking about their travel plans, especially if they are not feeling well, really monitoring that. And of course, officials still stressing today, Jennifer, the main way that we can fight this is to keep our hands clean, cough into our sleeves, keep that hand sanitizer handy, and just try to keep yourself removed if you are not feeling well at all.